About ovarian cancer and the symptoms of persistent bloating or swelling of the abdomen. Ovarian cancer is the ovary in origin related to the periton and the peritoneal reflections. Thus, we can recognize the symptoms of ovarian cancer related to GIT or always misdiagnosed as GIT problems. The patient usually go for treatment of dyspepsia, of nausea, of vomiting, of bloating, of abdominal pain. It is misdiagnosed and usually they are presented in later stages. Thus, the persistent bloating or swelling of abdomen, pelvic or abdominal pain, and feeling full quickly after eating a small amount, or presence of urinary urgency or frequency, and back pain or pain during intercourse, unexplained weight loss or change in bowel habit also. Thus, to sum up, we go for the uterine cancer as presence of post-menopausal bleeding, while cervical cancer is the presence of post-coital bleeding. In ovarian cancer, we go for symptoms like dyspepsia or persistent bloating or swelling of abdomen. The risk factors of ovarian cancer actually related to the age primarily affect the woman over 50 and genetic. Also, we have too many genetic problems related to the presence or occurrence of ovarian cancers at certain age, like inherited gene mutation of BRCA1 or BRCA2 mutation, and family history, like history of ovarian, breast, or colorectal cancer, and medical history of endometriosis, or in some cases, diabetes. Smoking and prolonged exposure to estrogen also, like no pregnancy or unopposed effect of estrogen by the use of uh, estrogen only pills without combined with no combined pills or hormone replacement therapy or diabetes mellitus and obesity actually related to increased estrogen level, and this is increased also the incidence of the ovarian cancer. For diagnosis of all type of gynae malignancy, we go firstly for the pelvic examination, like examination under anesthesia. This examination, we go to examine the uterine cervix. We go for HPV or human papillomavirus test by pap smear and colposcopy. In imaging also, we go for contrast enhanced CT or magnetic resonance image. This is important. Ovarian cancer also, and biopsy for pathology examination. Sometimes we go for PET-CT to detect the cancer staging prior to surgical intervention. Is positron emission tomography. This is a type of imaging depend on the presence of um, fluorodeoxyglucose, which radiate a little bit radiation and take the activity of high metabolic active cells, which is the malignant cells. Thus, we have high metabolic activity in these cells. It could be detected by the presence of take the fluorodeoxyglucose, and it help for staging and help also for proper decision making to go for chemotherapy or to go for surgical debulking. Okay, treatment guide. We go for hysterectomy or we go for surgery. Then we have to go also for chemotherapy, either in adjuvant setting after surgery or neoadjuvant prior to surgery, or even palliative to minimize symptoms in later stages. We have three types of hysterectomy, either radical hysterectomy to remove the entire uterus, including the cervix plus fallopian tube and both ovary removed. We have total hysterectomy, the entire uterus, including the cervix removed, and the partial or supracervical hysterectomy, the upper portion of the uterus or the uterine body is removed and to keep the cervix is left intact. The surgery is directly related and depends on the proper staging. If we have a lesion present only in the uterine body, we will go for the partial hysterectomy or surgical removal of the part of the uterus, while in total hysterectomy, we remove the entire uterus if the cervix actually was included or invaded by these tumor cells, and radical hysterectomy of the stage 3 disease as the disease spread widely to the uterine tube and fallopian tube or the ovary, also in other part of gynae organs. Only cervical cancer, this is the core part for the early detection and for prevention of gynae tumors. We have only the cervical cancer. It has screening tests that can find this cancer early. When treatment work best, the PAP test also help to prevent cervical cancer by finding precancerous cell change in the cervix that might become cervical cancer if they are not treated appropriately. A test called the HPV test look for HPV infection. As we discussed, human papillomavirus, prolonged infection, prolonged exposure is directly related to occurrence of 85% of rare cases of cervical cancer. It can be used for screening in women 30 or older. Firstly, talk with your doctor in order to prevent this disease. If you believe you are at increased risk, means by age, by positive family history of gynae tumors, or even in colon cancer, as the Lennox syndrome or hereditary non-polyposis colorectal cancer, this is also related to the occurrence of the gynae tumors, especially endometrial cancer, and breast cancer, and BRCA mutation. If you have both the family history of this breast cancer or BRCA mutant, you have to go for screening also for ovarian tumors. Thus, if you believe you are at risk, prolonged exposure to estrogen, unopposed effect of progesterone, obesity, smoking, HPV infection, it is important for all to know and tell the doctor about the family history. And if your family have health history of breast, ovarian, and other cancer, we should recommend genetic counseling and testing. It's important to recognize the symptoms, since there is no simple and reliable way to screen for any gynae cancer except cervical cancer. It's especially important to recognize symptoms and learn if there are things you can do to reduce your risk. What is the role of HPV vaccine? HPV vaccination prevents the new HPV infection, but does not treat the existing infection or disease. This is why the HPV vaccine works best when given before any exposure. You should get screened for cervical cancer regularly, even you received an HPV vaccine. The most effective way to prevent cervical cancer along with vaginal and vulvar cancer is HPV vaccine, recommended for preteens 11 to 12 years but available up to 45 years old. And regular screening by PAP and HPV test. This screening finds precancerous changes in the cervix early, and pelvic examination by annual examination. Also, it helps to detect the issue early. HPV vaccination is recommended for preteens at the age of 11 to 12, but can be given starting at age of 9. HPV vaccination also recommended for everyone to age of 26 if they are not vaccinated already. Some adults aged 27 to 45 who are not already vaccinated may get the HPV vaccine and the age range provide less benefit or more people have already been exposed to HPV. Cervical cancer is the only gynae tumor for which there is a standard routine screening test recommended for all women with average risk. Thus, we go for this brush and cervical sampling to detect in preclinical stage or stage 0 and stage 1 the presence of cancerous cell before it being visible with naked eye. It's important to keep healthy weight also by exercise and diet with regular physical activity. 20 minutes daily and healthy diet lower risk. Avoid smoking, as smoking is linked to HPV persistence and cervical cancer occurrence. Genetic counseling to testing for BRCA1, BRCA2, and Lennox syndrome mutation can identify the high-risk individual for ovarian and uterine cancers, especially with family history. Finally, you have to keep healthy life tips to stay hydrated. Drinking enough water, support digestion, circulation, and temperature regulation. Get enough sleep. Sleep allows the body to recover and maintain the immune function. Avoid tobacco and limit alcohol. This is reduced by reduction or reducing these substances. This is lower the risk for many chronic disease also. Obesity and metabolic syndrome strongly related to the endometrial cancer and ovarian cancer also. Hope to see you again. Thank you very much.